Good evening, everyone. We will start shortly. Please take your seats. Thank you, ladies and gentlemen, distinguished guests, and SIM authorities. Welcome to the event Latin America and the Caribbean, regional digital health initiatives that can inspire global change. It is my honor to open this co-branded session organized by the Inter-American Development Bank, taking place during the second meeting of the Health Working Group of the G20. We are gathered here, both in person and virtually, to explore how the Latin America and Caribbean region is paving the way towards a digital health transformation that can inspire other regions and countries to follow the same route. Before we proceed, I would like to inform everyone about the interpretation services available for this event. For those present in the room, please make sure to pick up the interpretation equipment and headphones if you haven't already done so. This will allow you to access real-time interpretation in Portuguese, English, and Spanish, ensuring you can fully engage with the discussions and insights shared today. For our remote participants, we have also arranged for a simultaneous interpretation. Please select the corresponding audio channel to listen to the event in your preferred language. As we delve into the heart of today's agenda, we will first explore the IDB-PAHO Alliance and the Pan American Highway for Digital Health, a landmark initiative aimed at revolutionizing trans-border healthcare through data exchange. This segment will showcase how this alliance is supporting the region in enhancing healthcare accessibility, efficiency, and patient-centric care. Following this, we will transition to a moderated discussion where leaders from selected countries in the region will take the stage to share their pioneering innovations in digital health. This discussion will focus on both regional and national levels, shedding light on how these countries are harnessing the power of digital health to improve outcomes and access. Through this dialogue, we aim to illustrate the critical role of initiatives like the Pan American Highway for Digital Health in fostering the adoption of digital health standards and creating robust frameworks for regional data exchange. We will conclude our event with closing remarks from Japan, the first official donor of the Pan American Highway for Digital Health Initiative, marking a significant milestone in our journey towards digital health transformation. Once again, thank you for joining us today, and I look forward to the productive and enlightening discussion that lie ahead. Let us embark on this journey together, forging a future where health will no border and digital innovation leads the way to a healthier and more connected world. So for our next section, I'd like to invite Pablo Barran, IDB Social Protection and Health Division Chief.
Thank you very much, Dale, and thank you all the participants in person and online. Of course, thank you to the Secretary of Information and Digital Health Brazil, hosting us. Very excited about this. So today we will be talking to leaders of the countries from Argentina, Brazil, and Colombia, Jamaica. We will start with a brief conversation with Marcelo, our colleague, the unit chief in digital health in the Pan American Health Organization. We'll be partnering with them and working with the government, so I'll pass the word to Marcelo so that we can more in their context and then go directly to the countries to tell us their stories. Thank you very much.
Thank you very much, Pablo. Pleasure always to share this with you. So, just to give a brief some on our relation and collaboration with the Inter-American Development Bank, I thought we had the presentation. We prepared a few slides. But the idea is to show something that was the generalization, the way we develop this collaboration that was based basically on technical agreement, mutual relations and trust. But we also have a discussion that started in 2016 with all the countries in the Caribbean, and we also had one idea that came from the Caribbean region, in where they suggested PAHO to work in a concept that they call, and they suggested we use the name of information systems for health instead of health information systems. That was a suggestion from a former ambassador at large in Dominica, Dr. Paul Ricketts. And at that time, 2016, he mentioned, think about that because the health sector will need data from all the different sectors of the government, and not just the data that is under the administrative authority of the health sector. And that was visionary with that. So we called for a meeting, and you will see that in the slide. In Kingston, we co-host that meeting with the government of Jamaica, and this is why also today is one of the leaders in the Caribbean implementing the digital transformation of the health sector. So we define with them, we work with them, we define a new framework for information system for health that we call IS4H. This is the previous slide, this one. But it's just two slides. This is the meeting that I mentioned here. But the key point here is that we agree with all member states in 2016 to define, first of all, and that was also mentioned by several countries here, we decided to work on the foundations. So we developed a framework that was organized in 4 different strategic areas, one on management and governance, the other one on information technologies and platforms. The third one was information and knowledge management, including health analysis, and the last one was innovation. And in 2016, we defined some recommendations and some KPIs on how to position the health sector within the digital transformation of government. And everything was in collaboration since the beginning with IDB, is there in the picture. And so we agree on a framework, and then we organized a session with Central American countries. They all agree with the framework, and then with the South American country. And in 2018, and we can go to the next slide, we passed a resolution, or maybe the next one, and then we can come right here for power. We passed a resolution that was highly supported by all the countries, and that time I always recognize, and I thank Brazil, because Brazil always was a champion on information system, digital health. We worked together in the RIPSA initiative, in a data for health network, etc. So we passed a resolution on information system for health. So we start with the conceptual model, then we develop the technical framework, and then we pass a resolution for member states. And that then became in 2021. We did something that we call from the evolution of information system for health to the digital transformation of the health sector. So we put a roadmap for the digital transformation of the health sector that is organized on the 8 principles that I presented at this morning. So this was in 5 minutes a summary of this collaboration. We have a strong partnership. We work in more than 20 countries in the region. We have periodic meetings to coordinate actions. We are now working also in the context of the new alliance that was mentioned by the Director of Systems of PAPO, who is present here, Dr. James Fitzgerald. So we have different initiatives in where always we are trying to add the element of digital health and digital transformation. The recently one also we are part and we are incorporating the concept of digital transformation in the also PAPO, World Bank, IDB initiative under the Last Commission initiative. So we have a lot of elements there in our collaboration that was also, I think, 5 or 6 months ago. We did some kind of a celebration between the director of PAPO, Dr. Jaron Barbosa, and the president of IDB to celebrate these 5 or 6 years of collaboration. And both of them mentioned that we need to use that example to expand to other areas in both organizations, PAPO and IDB. So with that, I thanks again, Pablo and the team for the support, and I will pass the floor to you. Thank you.
Thank you very much, Marcelo. And just to complement, I think For us, it was very important. We were also working in Jamaica when we discovered the need, and really to have two elements. One, that digital transformations need to be country-led, right? So we need to have a strong leadership from the countries, and then we need to work together as organizations that we are in the Inter-American system, work together to support countries. So we did our own internal transformation at the IDB, where we started to see, we have been investing in information technologies and equipment for a long time, but we were not seeing the results in terms of quality of care, reduced times, wait times, improved performance of the system. So to do that, we decided to build a digital health team, and that has been leading the way in the digital transformation in the social sector at the IDB. And then we also designed what is called our digital house, where we basically complement the 8 principles of PAHO with 6 pillars. And we insist we need to have balanced investments in infrastructure, culture, and policies in order to really have a transformation. And this is what we're seeing in the countries that we'll be talking today. Now we're in a new stage where we can talk about using digital health to improve access for indigenous populations, or use digital health to really confront the NCD challenge that we're facing in the region, or the mental health challenge that we're facing in the region. We have done the investments, and now we can move to that next stage. And also, of course, in terms of digital surveillance, for example, for pandemic preparedness. So I think this is what's really making a difference, working together, and also, I insist, with the leadership of the countries. So having said that, and in the interest of time and of listening to the real actors, I give the word to you, Leo, so that we can have the conversation with the countries. Thank you.
Thank you, Pablo. Now I'd like to invite to our moderate discussion with digital health leaders of the LAC region, Ana Estela Haddad, Secretary of Information and Digital Health of the Ministry of Health of Brazil. She's here with us. We also have online Dunstan Bryan, Permanent Secretary of the Ministry of Health of Jamaica, Federico Agustin Pedernera, Undersecretary of Epidemiological Surveillance, Information and Health Statistics of Argentina, and Daniel Mendes, Secretary of Innovation of the Ministry of Innovation of El Salvador. So my first question will be to Dr. Ana Estela Haddad. I'll ask the question now in Portuguese. Doutora Ana Estela, o Brasil é o maior país da região da América Latina e Caribe e tem o desafio de gestionar, compartilhar e analisar dados de mais de 200 milhões de pessoas. Como o Brasil está construindo o seu trecho da Rota Pan-Americana para a Saúde Digital, através da Rede Nacional de Dados de Saúde e outros esforços, e quais lições principais você gostaria de compartilhar com outros países nessa jornada?
Good night, everyone here. Thank you for being here. And I would like to thank IDB, Leonardo, Dr. Pablo, and also PAHO, Dr. Marcelo D'Agostino, for this opportunity, this side event, and for sharing experiences of the countries. And well, we had said that I would speak in Portuguese, Marcelo would speak in Spanish, and Dr. Pablo would speak in English. But we see that nobody using headphones, so we suppose it's better if we keep on talking English as we did all day long. So, okay. So sorry not to be so fluent, but I will do my best. And well, as the minister just said in the closing section we had today, the Ministry of Health of this President Lula mandate, and with her, created a new Secretariat of Information and Digital Health. And this was very important because we are trying to put things together. We're trying to integrate many things that were already happening, but they were fragmented. So, for instance, our Department of Information and Informatics, which we call DataSUS, has 35 years of existence, And during all this period long, he has created more than 400 systems of information. So, and all of them are important to different programs. We have historical series. We cannot just throw it out and start all over again. This is what we have, and we have to go with what we already have. Then we have the other department, a department of monitoring, evaluation, and strategic information. So it's the department which looks to the data, see the integrity of data, how can we use, how can we create indicators, how can we measure policies. And then we have a department of digital health and innovation, where we run telehealth and also innovation. And what we are doing right now, today we just launched a national program, which we call SUS Digital SUS. And we in the base of this initiative, as Leonardo just mentioned, we have the national network of health data. This is a platform of interoperability. So since we cannot really integrate the systems, we have this platform where we build up on a data lake. So we decide to let's say the electronic health records of the patient. Some services uses our own from SUS electronic health records. Other have private systems. So we decide the minimum data set, then we transform it into a informational model, a computational model, and with that we can have the standards to exchange data. So right now we are on the way to building up this national network of health data. And it's advanced, for example, in vaccines, but we have already the clinical records of primary health care. We don't have yet high complexity and hospitalar data, because we are moving into electronic health records, a common electronic health records. But when we do, we will have, because we already have an electronic health record, which we are recommending to the hospitals of SUS. So as soon as they adopt these electronic health records, we are already building up the interoperability of this system with this network. So this is more or less how we are going on. And building up this platform, we were able to have 3 interfaces. One interface is the app, or we have a super app which we call Mind Data SUS for citizens. So they have this, they download this app and they have their clinical data. They have many services. They have their vaccination certificate. They know if they are in the transplantation line, which is their position. We have an app for stimulating, promoting donation, blood donation. So they have the network of services where they can donate. We have now a functionality for the citizen to evaluate the service of primary health care. He can evaluate the unit and also the professional who has taken care of him. This is more or less, and we have the app for the health professional, which is the electronic health records in each of space where all over the country where the patient is has his clinical is attended. So, and we also will have an app for the managers. So we have the information in another level of aggregation so that managers also can have the information they need for a better decision.
Thank you, Secretary Haddad. So our next question goes to Permanent Secretary Brian of Jamaica. Jamaica is where both Information Systems for Health and the IDB PAHO Alliance began and is leading the Caribbean region with their IS4H work. How is Jamaica building robust digital health foundations for sustainable digital health, ranging from a legal, human resource, and information systems perspective?
Thank you very much for that question, and thank you. Can you hear me properly? Can you hear me well?
We can hear you now.
Hello? Okay. So thanks very much for that question. So we have been working with both the PAHO and IDB on a revolution in Jamaica. And there are several opportunities for collaboration with the entire government, because digital health is not a health intervention only. There's an interlinking that must take place with the overall infrastructure of the government and the people of the country. And so we have had a lot of learning over time. And as was pointed out earlier, we have implemented the information system for health, and that's the framework within which we are working, with the 4 clear areas of data management, governance, knowledge management, and innovation. Now, the philosophy that guides the implementation of our IS4H work and our digital transformation in general is one patient, one record. And that really encapsulates and captures all of the areas of work where we are trying to ensure that in our implementation, our systems and our ICT structures is patient-centric. And so one patient, one record is around the idea of a centralized digital record for each patient, the facilitation of a comprehensive and cohesive personalized care, the enhancing of efficiency, accuracy, and accessibility of medical information. This philosophy also tries to ensure that we empower our patients to have greater personal responsibility. And we try to promote through this philosophy collaboration among and between health systems in the private and public sector. And of course, it upholds the privacy and security standard, My Health platform. And that My Health platform really tries to set up a cohesive capability and also enable us to get the data and the data mining and the data analytics necessary to provide information to our clinicians so that we can have better outcomes for our patients. And therefore, we have looked at our digital has looked at not only integrating and creating a space for interoperability within the health system for the different solutions that we have in health, of which we have about 23 different solutions in health, by ensuring that we have that central point where all patients' information can be identified and located within the philosophy of one patient, one record. Into other systems, the IDB has been working with the government of Jamaica over the past several years for the implementation of a national identification solution that allows us to see all the citizens within our geographical space, and ensuring that they are identifiable and they can be properly tracked and also be provided with the information that will help them to move through and negotiate with government in the different areas of collaboration that we have as state and the individual. And so our electronic health record system, this is also within the context of our collaboration with the IDB. But more importantly, in November of this year, the government of Jamaica introduced its data protection legislation. And that data protection legislation codifies and makes into law some of the philosophical tenets of our health system, which is the protection of patient records, protection of patient data by ensuring that we have all of the necessary accountability systems. So the new legislation puts into place the laws, but it also puts in place the governance metric around the provision of data protection for all. And this is so very, very, very important to the rollout and implementation of any solution that we are going to move into. The work that we have to do is significant as we in this revolution that we are trying to create in Jamaica. And we are looking to ensure that these investments are sustained by the creation of organizational structures. So under the legislation, the ICT Council, the data protection officers, the data protection institutions that have been created. But right here in the Ministry of Health and Wellness, we have created an information systems for health unit to ensure that there are persons dedicated to the mandate and the that have defined in our plan for digital transformation here in Jamaica. So within the context of this conversation, there are several investments that we have made based on the learning that we have had and the collaboration that we have had with PAHO and the IDB. And we have utilized these now to launch out into a revolution of digital transformation, which will ultimately lead much.
Thank you, Permanent Secretary Brian. Now our third question will go to Undersecretary Pedernera. Argentina has a great challenge of being a federal country. However, it has promoted national interoperability based on robust reference frameworks and the incorporation of infrastructure at national level for the rest of the provinces. Given the inherent complexity as a federal country, could you discuss how standards such as the International Patient Summary play a role in Argentina's strategy?
Bueno, muchas gracias. ¿Me escuchan bien?
Escuchamos. Adelante, por favor.
Hablar en español. Quiero agradecer a las autoridades del BID y de la OPS que nos han invitado y contarles que
Thank IDB and PAHO for inviting me and tell them that we are just beginning a national government betting on digital health. And it is a pride to work in this new cycle we are working at. And to answer your question, I say yes, Argentina is a federative and a large country. And this also leads us to health situations that have a lot of asymmetries. But despite all of this, obviously having national public policies, not always the decisions that we health managers make take into account all the informations, generating access to the results and the health service of the citizens is not always the same. It is very important at the moment we make decisions, and that's why we want the interoperability standards or others agreed upon to be able to get information are elementary to reduce these gaps that we have due to the fragmentation we have in health systems in Argentina. If we are assessing continuously the development of the interoperability that allows us to connect to the runners of the different systems so we can share information of the health of our patients. And a clear example, besides the summary, I'll tell that we are working to implement the national electronic card, independent on the subsystems where the patients are, because we understand that interoperability and these resources allows us to follow the patient in their trajectory, seeking the services. So I believe that effectively the adoption of standards is necessary. The standards are necessary to be able to follow up the care of our system. Thank you very much.
Gracias, Secretario Pedernera. And our fourth question goes to Secretary Mendes. El Salvador is the current president of Raxel. How is El Salvador building their section of the Pan American Highway, and why is both national and cross-border interoperability a priority? How does Raxel support these efforts?
Hola, un saludo a todos. Gracias al Banco Interamericano de Desarrollo por esta oportunidad de poder compartir la experiencia de El Salvador desde un punto de vista diferente junto con la presidencia Raxel que en este momento ostentamos.
Okay, I will tell you from a different point of view from El Salvador. We developed many efforts with the lapse of the time since 2019. We highlighted the planning of the health services in more than 81 national hospitals and more than 700 local hospitals, which form the health network. And so other programs that include 187 public systems of health that were digitalized, not only with equipment, but also with technological infrastructure that support and offer the necessary tools for the physicians to work. So this exchange of data is important, and so that we can actually communicate through a process. But even so, after the pandemics, El Salvador was one of the first countries that was able to implement this system. And this is a very important step for a country to be able to advance and prioritize what for our region is important, and that allows us to start generating this connectivity or an interoperability in the borders. One of the things that we're doing was exactly to approach technological solutions that are very advanced to standardize health data. Thus, we based on technological platforms for the physician work. And then we can actually trust a relationship of trust on the part of the migrants. So we are working on these health services that are across the borders to allow the construction of enough room to have more data. So we can orient all efforts during 2024 to solidify this project. And it is very important that the Latin American and Caribbean region can have an interoperability of data to work as a region. So we can work as a region and we'll have better health conditions. Thank you.
Gracias, Secretario Mendes. Our next question, again to Dr. Haddad.
Vai para o secretária Haddad. How can the G20 support the convergence of the Pan-American route for digital health with other global and regional initiatives to allow the transborder exchange of information in health?
Thank you, Leonardo. Well, I prepared a few words. The importance of our regional and global efforts towards standardization and interoperability, for example, the global architecture needs to be consolidated under the principles of privacy, security, and trust. In this increasingly interconnected scenario, digital literacy is also a crucial skill to be developed. Also, the importance to approach the importance of the approach and solution centered on the user and their journey in the healthcare process. In this sense, we need to develop solutions that integrate and are placed place citizens and as owner of their health data. There are, especially since the pandemic, several global efforts and networks working towards a cross-border exchange of health information. These initiatives are important for countries to advance in digitalization, the use of big data, and the promotion of innovation, having particularities that are important to be shared globally. However, there is a risk of disarticulation between these initiatives, reducing the impact and potential of digital solutions in countries' health systems. It's necessary to reduce this risk, and the G20 can help build this systemic vision, sorry. The G20 is a fundamental space for collaboration between countries, for dialogue around the allocation of resources at the global level, and for the establishment of consensus that can serve as references for countless countries. The articulation and convergence that are discussed at the G20 have the capacity to be strong and sustainable. And finally, international collaboration is essential, as the G20 has a powerful role in global governance, having the ability to articulate these initiatives, identifying the strength of each one, and discuss a common direction. Furthermore, regional initiatives such as the Pan American Digital Health Route can become visible around the world and become examples of good practice that help guide international dialogue.
Thank you, Secretary Haddad. So make the same question to Undersecretary Pedernera. So I'll repeat the question. How can the G20 support convergence of the Pan-American Highway for Digital Health with other regional and global efforts to enable cross-border health information exchange?
Bueno, muchas gracias de vuelta. Con respecto a este punto, a mí me gustaría...
Well, this question is very important because in this point, I'd like to highlight that this is an opportunity I see. This initiative of the G20 that we try to adequate the formulas to be able to implement, that is something that is previous. The proposed technologies in each of the countries. What happens in Argentina and in Jamaica and Brazil and other countries, in El Salvador, we are present here, but other countries of the region, our realities about sanitary policies are very different. But I believe that the opportunity and the trust that they can reach these methods of health, that is digital methods, or digital resources for health, as I said in the beginning, it's very important that we take into account that we need to adequate and adapt to the culture of each one of the health systems. So to me, it is very important. And maybe we try to work this way with the international entities to be able to adequate to our reality, the good practices to be able to generate this information in digital health. I believe that this is a request. I don't like to use this word, but it doesn't really matter how close we are to the equator, but it is important that it requires an adequation to the reality of each one of the health systems. Thank you.
Gracias, Subsecretario Pedernera. Yeah. Now I'll make a question to Permanent Secretary Brian. How can we empower citizens globally to access and share their health information for continuity of care and public health purposes?
All right, thank you for that question. Now, sharing requires trust, and trust is the oil that allows citizens across the world here. We must build trust. And how do we build trust in our health system and in the technology that we are introducing? First and foremost, trust requires that open and honest, and that we ensure that persons are able to the benefit of passing their information. So there has to the citizen in terms of the importance to them and for them to see the value in sharing information. Since COVID-19, we have had a significant decrease in the trust factor in a lot of our health systems. The anti-vax movement has dealt a very significant blow on the ability of the population to trust that the health system is providing support and services in their interest around whether or not health information is being used for purposes that the population is not aware of. And therefore, we have to ensure that when we build our IT systems or information systems, that we put in place strong protective measures on the solution so that the issues around data breaches, data leaking, the issues surrounding data sharing without the appropriate approvals and authorization, and also the ensuring that persons are constantly aware of how their data is being used by putting in place all of the mechanisms for individuals. The need for us to collaborate is evident because within the context of climate change and also within the context of what we saw in COVID-19, the movement of disease across borders make it an imperative for our systems to be able to work together. In the recent conversations that we have had around HIV, especially in the Latin America, are able to migrate across borders without having that systems creates a risk that we need to manage as a health system in general. And therefore, it is without debate that we must invest in more structured ways of collaboration, but within the context of trust. And therefore, we have to find ways and means to invest in improving the trust deficit that exists right now in terms of information sharing, IT systems, and the perceptions that are in the population around the use of individual data and how that data has to be guarded and protected. We are able to see the benefits, but if the risks are in the minds of citizens, we will not be able to achieve this global sharing that we so aspire to get to achieve in the interest of public health. Thank you.
Thank you, Permanent Secretary Brian. Now our last question goes to Secretary Mendes, and it's the same question. How can we empower citizens globally to access and share their health information for continuity of care and public health purposes?
Gracias, concuerdo totalmente con el secretario Brian y creo que es algo importante. En El Salvador tuvimos la experiencia.
Well, I believe that's something very important. We see a fundamental experience, which would be to offer universal access in information technology. We cannot suppose as countries and states that the population use services where they are not going to have total access. We should guarantee universal access to information. And this is a fundamental element to education, information, learning, and the knowledge to generate a consciousness with regards to the use of health data that are fundamental for a better diagnostic. They are fundamental. We cannot just put aside the access nor education. So equally, the security of the data is fundamental, as Secretary said, so that we can guarantee the information of the citizen will be protected and that we can use their data without putting them at risk. Besides that, it's fundamental to articulate intersectorially, because we're not isolated from the other countries, but we should actually make an effort to unite and to create this information and this data that will be fundamental to obtain a positive result. So we should be in constant action with the tools that we place for all citizens. And it's important to have a communication with these tools so that we can share this information and offer the best service possible with the better quality for all citizens. Interoperability of the health systems is fundamental when the final user sometimes is not in the same place, and thus he should have access to several tools and should not be easy. It's not easy that in all countries we need the support of the IDB to have a better action, to have strategies, to be able to broadcast this knowledge to all countries of the region. And at the end, we are only one group, and we should share amongst us all the initiatives and tools that to generate a much more committed region with the well-being of the population, especially with regards to technology.
Thank you, Secretary Mendes. And I would like to thank our esteemed panelists for your participation. As mentioned at the beginning of the event, Japan is the first official donor of the Pan American Highway for Digital Health, an initiative promoted by the IDB and PAHO and led by the countries of the region. To conclude this event, the IDB Executive Director for Japan, Takashi Hanajiri, will give closing remarks.
Thank you very much. Can you hear me?
Yes, we can.
Thank you. Good evening, distinguished panelists, excellencies, dear participants of this hybrid event, and fellow colleagues of the Pan American Health Organization and Inter-American Development Bank. It has been a great pleasure to accompany you in this side event on the regional health initiatives, which sheds light on the leadership and innovation in digital health emerging from the Latin America and Caribbean region. Digital transformation respecting each country's system and ownership, data exchange based on mutual trust, importance of networking and infrastructure, so on and so forth, witnessing the clear vision and decisive leadership demonstrated by the government leaders from Argentina, Brazil, El Salvador, and Jamaica is truly inspiring. Also, it is great to see that these nations not only strive to enhance their own healthcare ecosystems, but also actively engage in collaborative learning and cooperation. I believe that the Latin America and Caribbean region offers invaluable lessons and experiences that hold great relevance and discussions within the Group of 20 Health Working Group and beyond. While the partnership between the IDB and PAHO has yielded commendable achievements, such as facilitating regional policy support and demonstrating the feasibility of health information exchange between countries. The new initiative, the Pan-American Highway for Digital Health, holds the promise of further amplifying this impact. This initiative is designed to go beyond national boundaries and foster regional agreements, enhance human capital in digital health, and leverage national investments to realize connected health for all. Since health challenges have no border, our solutions also should go beyond borders. Japan perceives the American Highway for Digital Health as a strategic investment. By fostering cross-border digital health services, we align national investments in this area and empower individuals and communities, creating a positive impact on the overall health and well-being of our global society. On behalf of the government of Japan, I would like to express my great pleasure of becoming the first donor to support this initiative. We encourage other countries and partners to join us alongside PAHO, IDB, and the participating nations in this significant endeavor. Together, let us forge a path towards connected health for all and more resilient world. Thank you very much.
Thank you very much, Director. And with this, we come to an end. I just want to, again, thank the panelists. I think it was very illuminating to have the discussion on how a big federal country as Brazil, but with a unified system, Argentina, another large country, federal, but with a fragmented system, and then the experience of El Salvador, who did this impressive connectivity of 100% during the pandemic, and then all the investments that Jamaica has been doing and the focus on trust. And I believe what the director mentioned at the end, we need to build this regional perspective, respecting and acknowledging the particularities of each country and the challenges they face, and partnering with PAHO and with the country leadership to try to adapt to the realities. So thank you very much. This was a very interesting conversation, and thank you for all of you who are connected and all of you here in the room. Good night.